So next is the inspiratory rise. So it's what is inspiratory rise actually? It is how rapidly you are reaching your target. For example, my pressure control I kept it as a 15. So during inspiration, what will happen? Pressure control used to be 0. At the during inspiration, the flow will occurs, reach the pressure control of 15. So it is depends on how rapidly I reaching that pressure control 15. That is the inspiratory rise time. For example, patient is having very breathlessness and very high respiratory. Those patients need that you have to achieve that pressure target as soon as possible. Then you have to decrease your inspiratory rise to 2%. Sometimes we will keep as a 0 also. If it is other way around, for example, patient is normally breathing, there is no respiratory, there is no tachypnea, there is no high respiratory drive. All on those situations, we can keep it as a 5%. 5% is a normally will keep in normal lung. If it is patient having very high respiratory drive, very tachypneic, in those situations, we can keep it as a 0 or 2%. So it is sometimes you have to subjective assessment. You can adjust. Sometimes you can, if patient is very tachypneic, you can increase that inspiratory rise to maximum 20 and see patient is improving with that inspiratory rise, or not improving, you can come down also. I think this is not time. It is example, it is not 5% means not 0.5 seconds. It is subjective. Some of the values of 5% to 20%. 20% means it's 0.4 seconds. 0% means it is a 0 seconds. If example, if you kept as a 0 second, during initiation of inspiration, within less than 0.1 second, the pressure control reach 15%. You keep a pressure control 15. If it is other way around, you kept a inspiratory rise time is 20%, which means that patient will take, the ventilator will take 0.4 seconds to reach the target pressure of 15. So it's very important whenever the patient being very tachypneic, high respiratory drive, in those settings you have to keep the inspiratory rise as low as. Next we are going to see about trigger. What is trigger? For example, if there is 3 types of triggers are there. One is time trigger, second is a flow trigger, third one is a pressure trigger. What is actually trigger? Trigger means, if example, patient having complete control mode, sedated, paralyzed, ventilator will give a breath and the specific interval. It is called time trigger. Based on your respiratory rate and IE ratio, patient will give breaths. For example, you keep as a IE ratio 1:2, breaths 15 breaths per minute. So ventilator will give every 4 minutes, it will give the inspiratory breaths. So it is called time trigger. If it is other way around, patient taking spontaneous breath. So if that is called assisted breath. Ventilator will assist the patient's inspiratory effort. Whenever the ventilator founds patient inspiratory effort, the ventilator will give the breath. So how will you identify the ventilator the patient is taking a breath? That is called based on the pressure and flow change in the circuit, the ventilator detect. So the patient is taking breath, so it will give the breath. It's called, if it is ventilators giving the breath based on the flow change, it is called flow trigger. Patient is giving breath to based on the pressure change in the circuit, which is called pressure trigger. So if it is completely patient is sedated and paralyzed, the ventilator give the breaths, it is based on the prefixed time. It is called time trigger. If the ventilator giving breath based on the flow change in the circuit, it's a flow trigger. Ventilator giving based on the pressure change in the circuit, it's called pressure trigger. First we will see about flow trigger. Before going to discuss about flow trigger, we should know that bias flow. Normally during inspiration, the ventilator give the breaths, the flow goes from the ventilator to the patient. During expiration, the expiratory flows, expiratory air, ventilator air, expiratory tidal volume will come from the patients to the expiratory limb to the ventilator. This is a normal breath. So expiration, there is no flow. At the time of expiration, there will be no flow from ventilator to the patient. This is normally we understand. But there is called bias flow, which means that there is some flow will occurs from the ventilator to the patient at the time of expiration, which is called bias flow. Normally it is 3 to 4 liter. Okay. Why this flow means, if example, if I during expiration and at the end of expiration, the patient is generating, want to give want to initiate the inspirator. So, how will you normally initiate the inspiration? You will take a negative. Patient want to generate a negative pressure. So, for the negative pressure, some amount of air, so example, some amount of gas, it suck from the circuit. For example, you kept as a 3 to 4 liter. Okay, patient generated negative pressure, it suck 400 ml of air. So, ventilator detect there is some amount of flow is sucked by the patient. So, there is a flow defect. The ventilator found a flow defect in the circuit. So, they think, oh, patient is taking breath. So, I have to give breath. So, it is called flow trigger based on the flow change. Okay, understand that is the normally there will be some flow during the expiratory phase also from the ventilator to the patient. It's called bias flow. If the patient generates negative pressure, some amount of this flow goes to the patient. So, the ventilator detect these flow changes and give the